Hello there, this is Dr. Wasim Khan. So with the winter season fast approaching and with what the world has gone through and is still going through with the rise of the coronavirus, it's important to get ourselves vaccinated more than ever before with the seasonal flu vaccination. So today I'll be going through what is herd immunity in the context of having the seasonal flu vaccination. I will also go into more detail about what the flu virus actually is and the importance of having the flu vaccination. So what is herd immunity? So the idea behind herd immunity is that if somebody has already had a virus or they've been previously vaccinated against a virus, then they should have some immunity. And essentially immunity just means somebody has a defense or protection against a virus. So now I will use a set of pictures which will help me to explain what herd immunity is. So as you can see from this set of diagrams, if you concentrate on the first set of pictures first, here nobody has been immunized. So as a result of this, the contagious disease spreads everywhere and to everybody. With the second set of pictures, some of the population has been vaccinated. So as a result of this, the contagious disease still spreads. However, it does not spread to everybody. Okay? Now with the third set of pictures, which is what we aim for, here most of the population has been vaccinated, so they've been immunized, they have a defensive protection against the virus. So as a result of this, when these people go on with their daily lives, whether it's going to work, whether it's going on holiday or wherever they may be, whether it's mixing with their friends or families, the contagious disease will not spread, and if it does spread, it's more likely to be easily controlled. So the idea around herd immunity is that if the whole population gets immunized with the seasonal flu vaccination, then the disease can be contained better. Now, in some cases, a disease or a contagious disease can be eradicated, as with the smallpox, which was eradicated through vaccination sometime in the year 1979. So what is the flu virus? So the flu virus is also known as the influenza virus, and it has different strains, A, B, and C. And it's called A, B, and C, or it has different strains because of a small change in the structure or the component of the virus. It tends to cause epidemics in the winter, so you tend to get a lot more cases in the winter season. Some of the symptoms include a patient may have a fever which typically ranges between 38 to 40 degrees Celsius, which tends to peak in the first 24 hours but then tends to come down in the next 1 to 2 days. A patient may also have a headache. They may feel fatigued and tired. They may feel extremely weak. They may have a dry cough, a blocked nose, also known as nasal congestion. They may have a sore throat. They may develop aches and pains all over their body. And they may also develop diarrhea and vomiting. The risk of complications from influenza is particularly high in the following groups of people due to the poor immunity, and these include people of all ages with chronic respiratory disease, including asthma, chronic heart disease, kidney disease, chronic liver disease, and also patients with conditions and treatments that suppress the immune system. Also, if you have diabetes, and also those patients who are 65 years of age and older. In terms of the complications that a patient may develop from the flu virus, these include a pneumonia, which is a more severe chest infection, and some of these changes from a pneumonia can be seen on an X-ray, and they may cause a patient to become short of breath, and in some cases, or in a lot of cases, patients can end up in hospital requiring further treatment. Also, if you have asthma, the flu virus can make the asthma worse, and in some patients with heart failure, which is weak heart, the flu virus can make their heart even weaker, so you may develop breathing problems as well as swelling of your legs and some other symptoms as well. In more rarer cases, which particularly affect children, the flu virus can cause infections of the brain, which requires emergency treatment. So what is a seasonal flu vaccination? So essentially, to put it into simple terms, this is a weakened or a dead form of the virus, which can be given through the nose through a nasal spray, or it can be given through the muscle by injection. And when this weakened form of the virus gets inside the body, it stimulates or it makes the immune system to produce proteins called antibodies. And it's these proteins called antibodies that help to fight off any further infections if you're exposed to them. and it can take up to 14 days from when you've had the vaccination to develop sufficient immunity or sufficient defense to keep you protected. So in terms of the side effects that a patient may experience following the flu vaccine or any other vaccine in that case, these include swelling or redness or pain or a lump or a bump at the site of the injection. Some patients after 1 to 2 or maybe 3 to 4 days may experience a headache, a low-grade fever, a blocked nose, maybe aches and pains and a bit of weakness. However, there are more severe reactions that can occur straight after the flu vaccination, and these tend to happen immediately, and these are allergic reactions or anaphylaxis, and these are usually quickly recognized, and the symptoms for these include such as a rash which may develop over the body, especially an itchy rash, swelling of the face, the tongue, any breathing problems, any wheezing. So that was just a very quick run through of what herd immunity is and the importance of having the seasonal flu vaccination. As a doctor myself, I would recommend or strongly recommend to get the flu vaccination, and please inform your friends and family about this as well. Thank you.